Welcome back to North State Health, the North State's first local health program.
And welcome back. Our guest today is Dr. Ray Powell from Physicians Plan Weight Management. And Dr. Powell, what do you do when you have patients come in and they want to see you about managing their weight? Because we did talk about it's not just weight loss, but it can also potentially be weight gain as well.
Right. What we do is we sit down, and I sit down individually with each patient. It's not in a group setting because it's a very personal thing that we go through where we have to literally go through every facet of their life as well as their medical issues. And then we really pretty much design a nutritional plan for them that's medically safe, that we're avoiding starvation type of diets, and we get them into a pattern where they're losing fat and we're protecting their muscle mass. And it's a lot of education.
Okay, and that's the most important thing because you don't want to lose weight and be losing the wrong...
Exactly. I always hear, you know, when Sally Joe loses 40 pounds in 30 days, well, guess what she's losing? She's losing a lot of muscle mass. And that's not good.
Okay, you want to keep your muscle and get rid of what you really actually want to get rid of.
Exactly.
Okay, so what is the most important problem with weight management that you see? What do people have problems with?
You know, there's two parts. There's one, and the New England Journal of Medicine actually put this out in about 2001. They call it food and liquid amnesia, where some people are just eating way too much and they don't realize how much they're drinking, and they're getting these 1,000 calorie coffees and different alcohols they drink, but other people actually don't eat enough.
Oh, wow.
And what I actually find is about 80% of the population go almost all day without eating, and then they do eat. And I call that the caveman, cavewoman syndrome. So I have a whole bunch of little lectures that we go through to really kind of educate the person on what they're doing right and wrong, and then we pretty much give them a specific catered plan for them to really get them back on track.
Okay, so I mean that would be one of those things you do hear people talk about. They'll eat a humongous dinner,
right?
And you'll say, wow, you know, that you shouldn't be doing that, and they'll say, well, it's okay, I didn't get lunch today. And but that can be a problem. That
ends up putting them into a storage mode.
Okay,
is what it does.
So it definitely is a process of how you actually have to eat. So that's where you guys come in. So I know a lot of the viewers out there, you've heard it on the radio, you've heard the word snealing. So what is snealing? This is something you developed, right?
Exactly. It is officially now a registered trademark. So it's actually my word. And what we've done is we've created a whole curriculum behind the word. It's got a definition, but it also has a whole bunch of different educational lectures that I give the patients. And you see on the screen now that I've got a variety of different things that we have to teach the patients, and this doesn't happen in one sitting. We've got to go through and educate them, review some of the ones we've gone through. I have what's called the gut lecture, the cave woman syndrome, the blood sugar roller coaster, where we add in more and more every time we see them. And we see these patients on a real regular basis to give them the power of understanding what the word is and then the definition, because the goal is to teach them how to do this with grocery food. But initially they need to be told and sometimes shown what to do, and a lot of them don't know what to do. So we've kind of created into kind of over the last 10 to 15 years literally a grocery store of very unique products that we use to really make sure we're protecting their muscle mass, stabilizing their blood sugars, and making them feel fuller longer as we're bringing them into a low or very low calorie diet. So there's a lot of science behind it.
Okay. What type of success have you seen with people that are following this, you know, SNEAL?
Oh, we have great success with the patients. You know, people will call us all the time and say, well, what's your success rate? Well, remember, as we've stated in the previous edition, that obesity is a disease. Well, how many people call a doctor and say, what's your success rate with your diabetics? It's obviously dependent on the person and making sure that they really get the understanding, and we see very high success rates with them getting, you know, 10 to 20% of their weight off, which shows a huge reduction in stress relief on the body. Okay.
You were talking about you know, the importance of eating in the different intervals and not just, you know, skipping a meal and that type of thing. Is it kind of almost like you think of your car, you know, you use fuel to run your car. I mean, it's one of those things. You would not drive your car on empty all day and then fill it up at night and say, well, it's okay.
Exactly, because the body is not a vehicle. What it does is when you do bring that energy in, it's going to say, yeah, I'm going to store it for the rainy day because you've been trying to starve me all day long. And that's really what we got to get into, is we got to show them that that this is what they need to do, and when they actually do it and they see the results, then they're like, wow, this really does work. And it really becomes a new pattern. It's when the stress hits, they'll fall back into the wrong pattern, and we have to teach them even how to deal with those kind of stressors to make sure they don't go back into a starvation mode. So there's a lot of physiology as well as psychology involved in it.
Okay, so SNEAL, it's a registered trademark.
It
so
is.
You can't steal the SNEAL. You can,
Right.
you can, follow it, and that's a good thing. We're going to get into the history and how you ended up coming about, like you said, being a doctor who also has basically a grocery store that people can go to help them, do their weight loss, weight management issues. So we're going to talk about that when we come back just after one quick break. So North State Health will be right back. Don't go away. It's just a 1-minute break.